Assalamualaikum and hi. Today our group will present about paranoia. This is our group members. Muhammad Faris bin Zulkifli, AMIR ASYRAF bin ZAINAL, Nik AQIFF ZAIDI bin Nik RUSDI, Raja Muhammad ZULHILMI bin Raja Muhammad AZIM. So this is the content for our presentation today. First, introduction of paranoia. Second, symptoms of the paranoia. Third, the diagnosis of paranoia. Fourth, the treatment that can be used for paranoia. Fifth, the psychological skills of paranoia. Sixth, support that we can give to the paranoia person. And the last is how to take care of this mental health. Introduction. First of all, we need to know what is paranoia. Paranoia is the feeling that you're being threatened in some way, such as people watching you or acting against you, even though there's no proof that it's true. It's a rare mental health condition in which you believe that others are unfair, lying, or actively trying to harm you when there's no proof. Paranoid personality disorder, PPD, is one of a group of conditions called cluster A or eccentric personality disorders. The essential characteristic of people with PPD is paranoia. This disorder often begins in childhood or early adolescence and appears to be more common in men than in women. There are several symptoms that can be shown from the paranoia. Paranoia person have doubts about the loyalty, honesty, or devotion of others, fearing they are being used or deceived. Paranoia person also are cautious to share personal information or trust in people for fear of it being used against them. Paranoia person have a hard time forgiving and holding grudges. They have a hard time receiving criticism because they are hypersensitive to it. They are generally chilly and aloof in their dealings with others in order to avoid being fooled, and they may become controlling and jealous. They are unable to see their own role in problems or conflicts because they feel they are always right. It's tough for them. Now, we will talk about the diagnosis. First of all, the doctor will do a complete medical history and physical examination. There is no laboratory tests to specifically diagnose personality disorders. The doctor also used diagnostic tests to rule out physical illness as the cause of the symptoms. Psychiatrists and psychologists use specially designed interview and assessment tools to evaluate a person for a personality. These are the treatment for paranoia, including therapies, medication, and other type of treatment. For therapies, patient can went for talking therapies that can help them understand their experiences and develop coping strategies to deal with them. Next, cognitive behavioral therapy is the most common form of talking therapy for paranoia is cognitive behavioral therapy, CBT. Other than that, arts and creative therapies use arts-based activities to help you express how you are feeling in a therapeutic environment. Finding a therapist you trust might make it more difficult to trust your therapist or to talk about how you feel. This can sometimes make therapy more important to try to find a therapist who you feel comfortable with. Medication you are likely to be offered an antipsychotic drug to reduce your symptoms. Antipsychotics like olanzapine 10 or risperidone may reduce paranoid thoughts or make you feel less threatened by them. If you have anxiety or depression, you may be offered antidepressant tranquilizers. Last but not least, paranoia treatment using virtual reality might help because, if you feel paranoid, you may avoid places or people that make you feel threatened, or use techniques to help you feel safe. New research is investigating whether virtual reality can be combined with help you to practice entering situations you are scared about and find out what happens if you don't use your usual techniques to help you feel safe. Now we move to psychological skill of paranoia. There are 4 psychological skills that we want to highlight and discuss today, which are talk openly, respect their wishes, see the good in what happening, and developing an exit strategy. First of all, talk openly. People who have paranoid ideas may feel isolated, yet discussing them might help them relax. Your point of view could reassure them and give them a new perspective. Then, respect their wishes. Even if you believe you know what's best, accept their desires and don't try to take control or make decisions for them. After that, see the good in what's happening. Lack of knowledge of one's illness or any accompanying concerns affects up to half of those diagnosed with schizophrenia. As a result, many feel their paranoid fantasies are genuine. Lastly, develop an exit strategy. Use a code to get out of the situation. For instance, a code like "I'm getting a migraine" if you don't want to talk about your symptoms. How to support the person who are experiencing paranoia. There are 4 steps on how to support them. The first one is do not argue with them. Try to talk to them if they want to listen to you. Second, we should use simple directions when talk to them. Tell them simple things to do so that they can understand that you are trying to help. Next, one of the important ways is to give them space. This will help them to keep calm and comfortable. This step also can avoid them feeling trapped or surrounded. Last but not least, we shall move them away from noises. It is because these people usually feels anxious when loud noise is coming towards them. Okay, now, how to take care of the paranoid people. These are some essential steps to take care of them. We should help the person avoid things he or she fears. For example, if the person is afraid of dogs, avoid them. Other than that, keep lights turned on surely will help them feeling less scared and safe. We should do it if only they tell them to. Plus, we also can talk about their fears when they are not paranoid and make a plan for handling the fear when it's occur. Just as importantly as other steps, we also can help them make list what are they fear of. At the end, try to assist them to make them believe the fears are their illness and seek help. These are our references that we took as our resource in order to prepare the presentation slide. With that, thank you.